A 70-year-old gentleman is referred from his GP due to AKI. His urea is 20, his creatinine is 350 from a baseline of 100. Outline your management of this patient. The overall management of AKI can be divided into 3 steps. Step number 1 is the stage of AKI. AKI is divided into 3 stages based on the creatinine value and the urine production, as you can see here. Step 2 is the history and the examination. Importantly, in the history, try to work out why the patient has AKI. In examination, assess the fluid status and always check the patient's medication, particularly any new medication he recently started. Step 3 is the initial management of the AKI. Now, this can be divided into pre-renal AKI, which accounts for around 3/4. Always give IV fluids. This is due to reduced blood flow to the kidneys, which could be due to dehydration from sepsis, diarrhea and vomiting, a massive hemorrhage, renal artery stenosis, or renal infarcts. Secondly, intrinsic renal disease. Always send off for urine dip. This is broadly divided into 3 causes. Acute tubular necrosis, which is necrosis due to the tubules from nephrotoxics, renal hypoperfusion from hypotension. Secondly, tubular interstitial nephritis, TIN, which is inflammation of the interstitium surrounding the tubules. Most commonly, this is due to medication. Always check if they're on antibiotics, antivirals, NSAIDs, PPIs, or diuretics such as furosemide. Thirdly, glomerulonephritis, which is divided into nephritic and nephrotic syndrome. Thirdly is post-renal. This is an obstructive uropathy. Always do a bladder scan, plus minus put a catheter in. Also catheterize the patient if they're on AKI stage 3, because this is the only way to measure the urine output. Get an ultrasound KUB if the AKI is getting worse. And remember cardiorenal syndrome due to pulmonary edema as well. Now, after instigating this initial management, if the AKI is still getting worse, then at that point, consider a renal screen and a renal review. Run, renal reg, run! Number 1, hyperkalemia. A potassium greater than 7 usually. Number 2, uremic complications such as uremic flap, uremic encephalopathy, uremic pericardial rub. Number 3, severe metabolic acidosis, usually a biocarb less than 15. Number 4, anuria for greater than 48 hours. Number 5, a refractory pulmonary edema. And number 6 is a rapid vasculitis, defined as creatinine greater than 400, pulmonary hemorrhage, or a history that's suggestive. These factors indicate that the patient needs urgent renal intervention such as dialysis or plasma exchange. Now remember the basic management of AKI, the indications for acute renal review, and monitor the AKI. Check out my next video on glomerulonephritis. Keep practicing and don't forget to subscribe.